Have you ever had a wound that you needed help with? Think back to when you were little and you had a scratch that needed a band-aid at school. Did a nurse help you out? How about when you were playing a sport? Maybe your coach gave you some ice for a sore muscle. Well, what about when you're an adult? Who will help you when you have a wound that you cannot fix on your own? At the Enloe Ostomy Wound and Hyperbaric Center, this is exactly what they do. This is a story about people who dedicate their lives to making sure that wounds get mended and lives are saved. I would like to caution you all. This presentation is going to include graphic content that may be uncomfortable for some viewers. Viewer discretion is advised from this point on. To start off, you might be wondering what ostomy, wound, or hyperbaric therapy even mean. Wound therapy is the practice of wound care medicine or non-chronic healing wounds. A special team of physicians and nurses who treat vascular or poor circulation wounds, surgical wounds, bone infections, pressure ulcers, or wounds from diabetes are treated with this type of therapy. Ostomy care is given to a person who has had an ostomy, which is an artificial opening in an organ of the body created during an operation such as a colostomy, ileostomy, or gastrostomy. Ostomy care is physician-directed care for patients with ostomies with cases managed by board-certified nurses. Hyperbaric oxygen therapy is used to treat chronic wounds. Doctors use oxygen under increased pressure to help wounds that cannot heal on their own. When the oxygen is increased, it helps wounds heal faster and kill bacteria. For example, it would be used in a bone infection or diabetic ulcer. In order to get a more personal look at how this type of center helps people, I wanted to get a better understanding of what it is like to work with these patients under these conditions. Margaret Carfey is a nurse who has worked in this field for 5 years now and says it is by far her favorite place to work. She has been a nurse for a total of 19 years, working in med-surg as a charge nurse, in the ICU, as a house supervisor, and now in the wound center. She told me that it was a much better environment to work in than the other departments because the time spent with her patients is much longer and she can build relationships with them. She told me that watching the patients go from life-threatening situations and follow them on their journey to leaving a critical condition towards stability and eventually complete health is the most rewarding feeling. She did not like being on med-surg because it was simply a diagnosis and then she never saw if a patient healed or not. In this field, she starts off with a patient in critical condition, convinces them to trust their lives in her hands, and does everything she can to help them heal and become a healthy human being again. While it is great to learn about the personal aspect of working in this center, I wanted to learn about the business behind the scenes as well. To get to this center, patients may refer themselves or their primary care physician can refer them for treatment. Financially, this department works with private insurance and government aid when receiving payment from patients. If you're looking for an internship in the Wound, Ostomy, and Hyperbaric Therapy Center at Enloe Hospital, it is a great place to look into for any students who are heading into the medical field. It combines many of the difficult types of the medical world. It brings out the trauma side for those who are interested in adrenaline. It brings the patient relationship side for those who want to get to know their patients, and it also brings in the research and critical thinking side as well when trying to figure out why a patient's wound will not heal or how to make their lives more comfortable in a critical state.